Everyone, and happy Tuesday. I'm Olivia Rios, Director of Operations and Programs at the LA Latino Chamber, and our team extends warm wishes to our fellow small businesses as we celebrate Hispanic Heritage Month. In today's webinar, we'll be discussing various aspects of healthcare insurance and its affordability. As we all know, health insurance is costly throughout our nation and very expensive for business owners who provide benefits for their employees. As a matter of fact, according to a few sources, the per capita healthcare spending in California totals close to $11,000 and slightly higher than the US average. And covered California states on their website, and I quote, "No one eligible for our coverage will have to pay more than 8.5% of their overall household income for healthcare. And for some of us, paying healthcare insurance is not even in our budget." As a community leader, leading organization in Los Angeles, the LA Latino Chamber brings two experts who will share their resource on how you can actually afford healthcare for your employees and yourself. With over several decades of experience in the insurance arena, our guests are Ken York, president at LifeExec, and John Santoyo, director and strategic advisor at LifeExec. The gentlemen will be discussing nationwide health insurance options with the 0% deductible priced at 50 to 75% less than ACA plans, and they'll talk about the ACA plans and what they mean. Unlock the potential for every business to enhance their retention rates. A $0 deductible risk business benefit offered at no cost per month, and explore alternative healthcare plans that offer essential healthcare and wellness benefits starting as low as $1 a day. And so, gentlemen, with that, I'd like to welcome you to our session and take it away.
So good morning. My name is John Santoyo. I'm a director and strategic advisor of LifeExec. First of all, I want to thank Olivia for setting this up, Daryl and Anna for providing these types of services through the chamber, Carlos for your technical help. I am actually in charge of large organizations, associations, alumni associations, so like, chambers, etc. And what we're doing, what LifeExec was founded for, was to address a critical problem in society. And I mean, as shocking as this sounds, 120 million Americans, so that's a third of the population, lack access to adequate health care. And 60% of the population has to decide between health care or prescriptions or rent, or, I mean, in this day and age, in this country, it's mind-boggling. It's staggering, and some people every year prescriptions drop off. They're not able to afford prescriptions. So it's healthcare affects every single one of us in one way or another, mostly in a negative way. And so LifeExec is committed to solving this problem, and regardless of age, pre-existing condition, income level, we work hand in hand with providers that share the vision and try to bring affordable benefits to everyone. And so with that, I also wanted to do a little bit of housekeeping. We changed the link, so if you were following, or if you click through on any of the email messages from the chamber, there's now a onboarding page for small business. So real quick, at the top for Advantage Wellness Complete, which you'll hear today, there's a DocuSign because we're collecting sensitive information, personal information. There's an e-commerce page for the wellness benefits, and then there's the onboarding for small business at the end. So with that, I will turn it over to our CEO and chief evangelist, Ken York.
Yeah. Hi, everyone. My name is Ken York. I am not in California. This behind me, this is Bend, Oregon. So just right up the road. If you haven't been here, it's beautiful. I was just down at your association a meeting down there in California. Always love visiting down your area. So welcome. Thanks so much for joining us today and spending a couple minutes with us to learn about what we do. As John was saying, we're incredibly passionate about changing healthcare, disrupting healthcare, most importantly, making it affordable, making it something that each and every one of us can now live our healthiest lives because we have access to affordable healthcare that we're not afraid to use, right? And California, believe it or not, we provide programs nationwide. We provide programs to thousands and thousands of businesses across the country. California is near and dear to our heart because, believe it or not, you have some of the highest insurance rates in the country, and you have an individual mandate, which means everybody has to have insurance. Otherwise, you're going to get dinged on your taxes. So what we do at LifeExec, as everybody has alluded to, is that we are creating programs that are affordable, that provide access to the best care possible, that actually encourage you to use your healthcare. Believe it or not, what I'm going to show you today. If you ever thought, what was kind of funny, if you ever thought that healthcare could never be exciting, never be something that you would be excited to hear about, excited to tell your friends about, excited to tell your coworkers about, believe it or not, what you're going to see today is something that's completely revolutionary, completely breakthrough, something that's actually award. We are winning one award after another, and you're actually one of the first people to actually take a look at it. And you're about to be on the ground floor, something that's pretty exciting. And so I'm going to share my screen now. I'm going to go through a presentation. It's a really quick presentation. It's probably going to take us about 20 minutes. This is for you. This isn't for me. I know all about the program. So as you start seeing things and you have questions, go ahead and put them in the chat. Go ahead and type them in. John's going to man the chat. If it's something that's a quick answer, if at the end of it, we'll take a look at all the questions at the end and make sure everybody understands the program and what to do next if you're interested in pursuing it further. The other thing that we're going to do, though, is I'm going to ask you just some feedback. If you see something, and you don't even have to wait for me to ask for the feedback, but if you see something that's interesting, if you see something that you think is cool about our thing, throw a thumbs up, all right, this is great. Give us some feedback. Let us know that we're doing a good job. And we'll make this interactive and fun. So with that, I'm going to share my screen. And we're off. So again, LifeExec, we do health and wellness benefits. Now, when we say health and wellness benefits, what does that mean? What we're going to talk about today are really affordable healthcare programs, like we said, that are completely reshaping health insurance. What you're going to see, what I'm about to show you, is the first program completely of its kind. In a year from now, in 2 years from now, in 3 years from now, I guarantee you, every single program that you see across the United States is going to be based on what you're about to see today. That's how disruptive what we're doing. This is how game-changing what we're doing is. By the time everybody catches up to us, we'll still be 3 or 4 miles farther down the road. Our stuff keeps getting better and better and better. So I'm going to show you that award-winning healthcare plan. We have won Best Healthcare Program of 2023 and 2024. We've actually been awarded a ton of different stuff. You can hit our website. I think we're up to about 10 awards on this stuff now. After we do that, I'm going to show you part of our program is not only to give you the best access to healthcare, but we're going to show you how we're going to save money. So we're going to give you the healthcare program, but I'm going to show you how it actually saves you thousands and thousands of dollars on your healthcare costs. Now, here's the thing, is like John said, there are 120 million people that do not have access to affordable healthcare right now. Inflation is through the roof. People don't have disposable income. One of the first ththings to go, unfortunately, is healthcare. Believe it or not, 60% of all people are now going without their medications because they can no longer afford them. What we're going to do is if our program, which is going to save you thousands, if it's still too expensive, we are going to show you programs that you can get at $1 a day. These are amazing for your employee benefit programs. After which, that's exactly what I'm going to talk about. I'm going to show you how you can not only get these programs for yourself, but more importantly, or equally as importantly, get them for your business, because that's boosting recruiting, that's boosting retention, that's helping you build your company, build culture, when you have happy customers, the best way to guarantee that you have happy customers is if you have happy employees. All those interactions are very positive. There's nothing that builds culture better, and this is statistically, than offering healthcare benefits. So we're going to show you how that is a zero risk program. You can hop on board if you have nothing in your budget. If you have no benefits today, you do tomorrow. I'm going to show you how to do that. After the end, obviously, I'll show you how to learn more about us. Obviously, we always want everybody to make an educated decision. Do what's best for your business, do what's best for yourself, do what's best for your family. I'm going to show you where you can get some more information so you can make that educated decision. All righty, here we go. Here it is. Voila. This is our new program. We've been working on this program with the top insurance carriers in the United States for a year and a half. This is called Advantage Complete. This is our flagship program. This is full major medical insurance. The things that I'm gonna talk to you about this as I walk through this today. You will not find in any health insurance program anywhere in the country. This is everything that you see here is exclusive to us. So the first thing, the most important thing when we started putting together this program, like we said, we wanted to create something that was affordable to everybody, something that actually provided the best health care. So obviously we started with our essentials. So what we started is we work with an A+ rated insurance company called 5-Star Insurance. If you Google them, nobody off the street can go and purchase that insurance off the street. This is exclusive to military professionals, firefighters, police officers. Is a government-backed program, and LifeExec members. This is an A+ rated insurance company that's been around since 1943. They have absolutely millions and millions of clients. You will not find, if you go onto Forbes list of best insurance companies, every single year they're #1. You will not find better insurance than this. So obviously that was their foundation, best insurance company. The next thing that we did is obviously make sure everything that you want out of insurance is covered. So yes, you get primary care, urgent care, hospitalization, wellness. You have everything that you expect out of insurance is included obviously into this program. The next thing we did though is this is where we started to break away from every insurance program in the United States. When you sign up for this program, you are part of the largest nationwide network of healthcare providers. That means you have over 1 million doctors. You have over 8,000 hospitals. I have yet to do a presentation where somebody did not have their physician within this network. I'm going to show you where you can look up your doctor if that's important to you. If you don't have a doctor, you now have access to every single doctor. What this also means is people travel. So when you buy insurance today, if you buy an HMO plan specifically, or even a PPO plan from like a Blue Cross Blue Shield, they lock you into a specific network. A lot of cases with an HMO, they're going to lock you into a specific area. Kaiser's big in California. If you travel outside of that network, you are no longer a part of that healthcare coverage that you're buying, which means you're paying 100% out of pocket. That's traditional insurance. With us, go anywhere, all 50 states, you are covered pretty much no matter where you walk in, you have healthcare coverage. You have healthcare insurance. We travel with you. Next thing that we did though is we took a look at this and we said, you're paying to get healthcare coverage. Right. And so what we did is we turned around and we said, great, let's give you the best. Like we said, we want to give you the best, not only the best healthcare programs, but we want to encourage you to use them. What does that mean for a second? Right now, and ask yourself this about your health insurance program. Most people in the United States are afraid to use their health insurance. They spend hundreds of thousands of dollars every year, hundreds of dollars every month, sometimes thousands of dollars every month, and they don't want to use it because as soon as they use it, they have to pay more money. With us, now take a look at this. You start using ours, you're going to have, we actually provide, when you pay for your premium, you pay to be a part of this program, you are going to find a hard time paying for anything. Your insurance is actually covering your healthcare. Novel idea, right? So get this. Look at all these things. And these are just some of them. You get $0 wellness program. What does that mean? We will pay for 2 wellness visits. So cancer screenings, obviously your physical exam. We will pay for your labs. But not only that, not only are we going to pay for 1, which you typically get with a lot of insurance companies, we will pay for 2. Why do we pay for 2? Because if you go into a cancer screening and that comes back positive, you have to go in for another cancer screening, hopefully, so it comes back negative, right? That second one would cost you $2,500. So we give you 2. Some people, and some of you probably even on this call, have to get labs done once a quarter. We give you 8 labs as part of this for a year. Labs can cost anywhere from $750 to $2,500. You have 4 major diagnostic, 4 minor diagnostic. That's included in this. Check out, but we also have sleep apnea testing. We have bone density exams. We have smoking cessation plans. If you want to be well, if you want to live your healthiest life, odds are that those wellness programs are included in this at no cost. Now take a look at that next line item, those $0 medications. What did I say at the beginning of this? 60% of all people right now are no longer fulfilling their prescriptions. Why? Every single year, 15 to 20 medications fall off your covered medication formulary from traditional insurance. With us, check this out. $0 medications, 3,000 medications are included. What does that mean? If you're getting 98% of the medications that are currently prescribed in the United States, with our program, we will cover 100% of that cost. There is no limit to the number of medications you can take. There is no limit to the number of refills. It's even better than that. If you are on a chronic medication, like a cholesterol medication, we will send you a 90-day supply, not a 30-day supply, absolutely free on day 61. You receive a text on your phone that says, would you like to get your next one? Within 5 days, we'll send you another 90-day supply. That's how awesome this program is. The average household spends $120 a month in medication. That obviously is $1,440 a year. We cover that cost. On top of that, everybody's into virtual care. Personally, I love virtual care. Right? I have a bump, a bruise, a scratch. I got a bite. I have a sick. I'm feeling ill. I can talk to a doctor within 10 minutes. You have that access to us. Unlimited visits, $0 visits, but we took it even farther. You can also get a virtual doctor, virtual primary care doctor, absolutely free. What does that mean? Now, I have a nationwide network, I can get my doctor here at his office. But those visits take a long time to get in. Nationwide average is 27 days. With this, you can also get a virtual primary care doctor. That means I got to go hand select somebody. So I'm going to pick a male who's 50 years old, that we're dealing with the same things. I'm talking to somebody who understands me, and that is my primary care doctor. I get to talk to, Dr. John anytime I want, and I don't have to wait 27 days. What's even better about that, I can have my primary care doctor here in the office, and I can have my virtual primary care doctor. So when one of them tells me one thing, I can bounce it off the other. I automatically get a second opinion, which is so important with your healthcare. That's included, 100%, 0 cost. Talk to that doctor as many times as you want. It will cost you nothing. We also provide you free mental health. That means psychiatry, psychology. It is virtual. You get unlimited visits, absolutely free. That's the number. We threw that in there because that is the number 1 most requested feature of out of benefits for every employee across the country. Yours, no cost. Think about that. That is, if you go to a psychiatrist, psychologist, you're probably paying $200, $300 a month for that. That's included in this at absolutely no cost. We then went farther. I mean, this is mind-blowing already, right? Like you've never seen anything like this, and you'll never find anything like this in insurance. We took it farther. We added in long-term care coverage. Why is that? So you have long-term care insurance in that. Why? Because Washington just passed a law 2 years ago that requires you to have long-term care insurance, or you have to pay on when you pay your taxes for it. Guess what? California, it's passed. They haven't implemented yet. You are going to be required to have long-term care insurance, or you're going to get dinged on your on your taxes when you do taxes. That is baked into this program. This program is built for you. This program is built for Californians. This also includes burial insurance. If you pass away, we're going to give your family $15,000 within 24 hours. I can tell you, I've actually just had a couple of people that lost their parents. Humongous relief. This is almost like a retirement package. You have long-term care insurance, you have burial insurance. Now check this next thing out though. Why do we have this? We have $100,000 life protection plan. On the next slide, it'll tell you why. But I'm going to tell you right now, the number one reason for personal bankruptcy in the United States is unexpected healthcare bills. Why is that? Is that you're paying $700 a month for your insurance. You have a $5,000 deductible. You go in for an appendectomy, that costs you $18,000. You now got $12,000 bill. You don't have $12,000. You have to declare bankruptcy. Think about that for a second. You're buying insurance to protect you from financial issues. That insurance is the reason that you have a financial issue. We will never let any of our members go bankrupt from their medical costs. We baked into this $100,000 life protection plan. What that means is our insurance is going to cover way more than your traditional insurance ever will. And I'll share with you in just a second how and why we do that, how that's possible. But if at the end of it, just like every insurance, you may have costs left over. At the end of the cost, if it's a major medical, you can actually pull from this life protection plan and apply it to this. If I went in and had an appendectomy, appendectomies cost about $18,500. With a traditional silver plan, my cost is going to cost me about $12,000 out of pocket with them. With us, it's $4,000. We're beating them by $8,000. Like, our insurance is that much better. But that $4,000 is still $4,000 you can pull from your $100,000 life protection plan to cover that $4,000. If you went and had your appendix removed tomorrow, and it happens suddenly, you don't plan for this, your out-of-pocket costs with this program would be zero. That's what insurance should do for you. Here's how we even got better. Unparalleled value. You should probably look at those tables right now, and if you did, and you're paying for insurance today, you're already blown away by that cost savings. We are going to save you 40 to 70% over an ACA. So that means Blue Cross Blue Shield, what you would buy from healthcare.gov, any of those programs, where we come in less, 40 to 70% less than every single one of those. But we have no deductible, $0 deductible. We are paying $1 on top of that. You are getting something for your money. You're getting a return on investment. Even better than that, going back up to that life protection plan, when you sign up for this plan, that money is yours. We create a fund with your name on it with $100,000. If perchance you don't use that, or anything that you don't use, it turns into a death benefit, goes to your beneficiaries. So think about this for a second. I'm 50 years old. I'm going to be paying here. I'm going to be paying $444 a month. So let's round up to $5,000 a year for insurance. So think about that, $5,000. I would have to be a part of this program for 20 years to break even on that $100,000. This insurance, and you're probably wondering, how is this even possible? It's honestly because we're not spending $1 billion every year on TV advertising. We're reducing this cost. We're coming in here with the actual mission to give everybody access to healthcare. We're streamlining our operation to pass those savings off on you. Believe it or not, this is what everybody else could be doing too. We're just doing it. We've just made the decision to put your healthcare, to put your finances above, absurd profits. And so in which case, this, like I said, and this is where, because this is what we're doing, and we're growing. We're the fastest growing insurance company in the United States. We are going to disrupt this industry. We are going to help change it. You just have a chance to be on the forefront of it. Take a look at these tables real quick though. How about that? So if you brought Advantage, Complete as an individual, our average cost is $444. If you went to the ACA right now, you're going to find that your cost is higher than that. This is last year. This is 2023 number, $653 on average. Next year, when you go in October, starting October 1st, that number is going to be probably close to $700. As a family, look at this. If you have a family and you're paying $2,200 a month for insurance for your family, you can reduce your cost to about $700 a month. That's $18,000 a year in savings. That's how much you're going to be saving. It's basically, I don't know how much everybody's rent is, but we're going to be paying a good chunk of everybody's rent or their mortgage. If you take a look at our premiums, just to give you an idea, it's based on age. So if you're 30, it's $339. If you're 50 like me, it's $444 a month. For a family, it's $702. So in which case, we're getting in. If I went to the ACA on October 1st, my cost for my insurance would be $740 for just me. So I can actually get my entire family insurance for less than I can get an individual. This is meaningful savings. But let me talk a little bit more about, let me show this. So we're going to save you on a premium, but as an individual, we're going to save you anywhere from $3,000, and as a family, $18,000 a year. How would you, the other way I could do it, and we debated this, is I would charge you the same amount as everybody else, but I would just give you a free trip to Hawaii every year. You let me know if you guys would prefer that. I'll just buy a trip to Hawaii. The next thing we could do, though, is where we save you money. Like we said, we have a $0 deductible. Deductibles run anywhere from $5,000. Family plans now have $20,000 deductibles. That means on top of your premium, when you start to use your healthcare, this is why everybody's afraid to use their healthcare, you have to pay those deductibles as well. So if I had $700 a month, I'm $8,400 a year, but I have a $5,000 deductible. My healthcare insurance would cost me $13,000. With us, I'm paying $400 a month. I have a $0 deductible. My cost is significantly less. This is where we're saving you money. We also don't have co-insurance. This is something that pay attention to this year, specifically. So it runs anywhere from 20% if you're in network, 30% if you're out of network. What that means is after you get your bills, after you've paid your deductible, the insurance company says, okay, you've paid us the premium, you've paid your deductible, so why don't we'll share the cost. You pay 30, we pay 70. Blue Cross Blue Shield, their rates for everything have gone up dramatically. They've kept a lower rate on an HMO program, and get this, with a 50/50 deductible. That means after you've paid them your premium, after you've paid your $5,000 deductible, that bill shows up on your door for another $5,000, and they're going to say, hey, let's split it. You paid $2,500 and we'll pay $2,500. Just so if everybody knows, is if you went into the hospital without insurance, they would hand you a bill that would be 50% of what they would bill the insurance company. So ask yourself, what are they actually paying for, right, in that scenario? So anyway, so that's pay attention to that this year. If you do go to healthcare.gov, I'm not a big fan of co-insurance. The other thing is the $0 programs. If you're spending $100 a month in medication, heck, that's $100 off your bill every single month. You have two, if you have a family, obviously that starts to grow. Obviously, with our other programs, our wellness programs, our labs, our other things, we have people that are going to be saving $10,000 this next year with all of those free programs that we offer. Obviously, that differs for everybody, but what doesn't differ is that we're very proactive about telling you, go do a wellness exam, go get your labs, find out what's happening inside of your body, so you can actually stay ahead of it. Preventative wellness is a much better place to be than on the other side of it. So this is how we're helping you. Now, that's our flagship program. That is the most exciting program in the United States. Hopefully that's exciting to you. Hopefully it opened your eyes to a new opportunity. If you're looking at those programs and going, those are still expensive, I don't disagree. Health insurance is an expensive cost. What we've done, our mission is to help everyone protect what matters most. Our mission is to make sure everybody has access to affordable health care. So what we've done is we've created what we call hybrid programs. These programs have direct primary care. And so instead of routing yourself through an insurance company to get care, what we have is we have a network of doctors that'll work with you without insurance. They're fantastic doctors. It's actually the direction that that health insurance, all health insurance is going. The people actually dislike health insurance the most, believe it or not, are physicians. They only collect about 70% of the bills that the insurance company says they're going to pay. They only get about 70% of those, and they typically get it within 90 to 120 days. Really difficult to run a business that way. So what we've done with this is we have 3 programs. One, they all build on each other. So you'll see that we have Advantage Essential, gives you telemedicine, gives you dental, gives you vision, gives you pharmaceuticals, gives you labs, testings, wellness exams, kind of almost everything that you need from a day-to-day standpoint. And that is available at $1 a day. For a family, it's $2 a day. What we added to that with Signature is what we did is we put accident insurance. So believe it or not, everything that's included in this plan covers 98% of every single visit that occurs in the course of a year. I have absolute millionaires that have dropped their insurance and went to this just because they're going to save so much money. They're going to put it in a bank account. So if they ever actually have something major medical, that they'll be able to pay for it with the savings from insurance. Pretty novel idea. This has telemedicine, dental, vision, pharmaceuticals, everything we talked about, wellness exams. Plus, if you get a cut, a burn, a fracture, it's basically going to pay for almost all of that with a $0 deductible. Now, what we did is we elevated that plan just slightly farther to Advantage Premium. That's $129 for an individual a month. That's only $4 a day. That gets you direct primary care. I can go into a doctor's office for a $10 visit fee. I can go into urgent care for a $25 visit fee whenever I need to. It's great for chronic illnesses. There's 13 chronic illnesses. If you have diabetes, if you have COPD, if you have any of those conditions, we have caregivers for you. That's only $4 a day. But now take a look at this from an employee standpoint too. What we have is this is an amazing cost savings for you. But what we also have is this program is custom made for businesses to provide health care to their employees. 70% of all job seekers list benefits as the number one motivator for taking a job. So now what we've seen job postings, people, small businesses that never had benefits before, putting on the bottom of their ad, we offer benefits to our employees, and they're able to if they're able to sit there and say, hey, I'm going to provide $30 a month. I'm going to give everybody Essential. If they want to upgrade to this plan, great. I'll meet them in the middle. They spend 30, they'll pay 30, I pay 30, or maybe I'll pay the 60. I mean, if an employee came to you tomorrow and said, hey, I'm going to quit unless I get $1 a day raise, right? That makes sense. And that's what happens. Retention goes through the roof, recruiting goes through the roof, culture is dramatically improved as soon as you start offering benefits. These benefits are custom made for every business to offer benefits tomorrow. You can turn around and say, I'm going to give you telemedicine, dental, vision, pharmaceuticals, lab testing, colonoscopies. If you get a cut, a burn, a fracture, you can go in, it's a $0 deductible, and you're going to be covered. That's going to cost you $2 a day per employee. That is really powerful stuff for every single employer. Personally, and if it's something that you're just looking to cut costs, it's great. Just remember, in California, you do have the individual mandate. So you have to have something that's ACA qualified, which these are not ACA qualified. I just want to be transparent there. The other program, Advantage Complete, is. So finally, what we've done, what we did is, and where we started with this, is we turn around and we said there's two big problems here. One, there's 120 million people that don't have access to affordable healthcare. The healthcare that's out there, it's not doing the job that it should. So this is where you see that how we've completely changed the healthcare industry, or we're changing the healthcare industry with our new programs. The other problem that we discovered, though, is that 31 million businesses, 99% of all businesses in the United States are small businesses. 90% of those businesses currently do not offer employee benefit programs. And what happened in 2022 and 2023, and many of you on here probably experienced that, is it was called a great resignation. Everybody quit their jobs. 4.5 million people each year quit their jobs. And the reason being is they were looking for healthcare benefits. Nobody got hit harder than small businesses. 500,000 small businesses shut their doors each year specifically because they didn't have enough employees. Just me and my right down here, and right at the, I can almost point to it. It's one of my favorite restaurants. I went there one day and there was a handwritten note, sorry, we're closed because we have no employees. Happened everywhere. Don't let that happen to you. And so I love my favorite restaurant. I never want to see them close again. So we created this program to be the perfect program for every single business. The features of this are this. It's any business. Any business. You have one person, one employee, you have 10,000 employees. We will provide benefits to your business. This is you won't find this program anywhere else in the United States. The second thing is any employee. So what you see with traditional programs is they're only going to work with employers of a certain size. We don't have that requirement, but then they're only going to offer benefits to full-time employees. On top of that, we eliminated both of those restrictions. So you can be an employer with 5 people, with 10 people, with 3 people, with 20 people, with 100 people, and you can turn around and you can tell us, hey, look, 10 of those people are full-time, 80 of those people are part-time, 10 of those people are contract workers. It doesn't matter to us. Offer benefits to everybody. On top of that, we're going to do any budget whatsoever. And by the way, we have no knockout question. We only have one knockout question. So basically almost everything is completely guaranteed issue. All the benefits that you saw today. We have, and we'll fit any budget. If you came to us today and said, Ken, I have $0 in my budget. I have nothing in my budget for employee benefits. Awesome. You have benefits tomorrow. Sign up. We have no minimums. We have absolutely no minimum. If we will do, we have no monthly commitments. You can offer this program 100% voluntary, which means your monthly cost is nothing. How about that? Just, hey, run out of program. And why do we do that? It's because our programs are so good. Our programs are so impactful that we'll do an enrollment campaign coming at this knowing that, hey, we have the best product on the market. People are going to buy our products. We will invest in you as a company because, again, our mission is help everyone protect what matters most, make sure everybody has access to affordable healthcare. We look at you as our partner in helping us do that. If you do have something in your budget for it, if you have $5, you have $10, you have $20, if you have $120 a month, whatever it is that you want to spend, we'll help you customize a program. You can provide benefits for your full-time employees, certain ones that are 100% paid. You can do certainly and provide a stipend for everybody else, your part-time. However you want to customize it, we can customize it for you. We'll work for you. We'll also get you up and running and out the door in 30 days or less. It's obviously up to you, but that's how fast we can move. The final thing is everybody who signs up is we get an enterprise grade program. We will build you your own branded employee portal for people to pick out their programs. We will provide you live support. We'll provide you monthly reporting. We'll provide you quarterly updates, with new benefit opportunities. We will run an enrollment as often as you want us to. So if you have a higher turnover, and by the way, your turnover is going to go way down, but if you have a higher turnover, we'll do one a quarter, we'll do one, we'll do 2 a year, we'll do 1 a year. However it fits your company, we'll fit your company. Now, the neat part about our program is, like I said, part-time, full-time, contract workers. Our programs are evergreen. You don't have to sign up for between October 1st and December 15th. You can sign up in January, February, March, April, May. Doesn't matter. Whenever you want to sign up, it's evergreen. We'll meet you where people are, and not only that, when they decide to make an investment into their health. So again, none of these things you're going to find in anything else. We work with you. You're our partner, and we're going to do everything that we can to make our benefit program a success for your business. You're going to be able to recruit, you're going to be retained, you're going to build culture with this. And if you don't have it in your budget, awesome, we'll cover it as well. So that is it. Before I move on, I'm going to show you some cool stuff about next steps. You're going to get this, or at least the links in it. If you do get this, these are links. This will take you to a website so you can go learn more. I'm going to show you that in just a second. And then if you're a business, so this is for personal benefits, and to sign up for your business as well. If you want to do a tour and find out more about this for your business, you can schedule a tour with one of our business consultants. And we work with so many different businesses that are out there that once you get in, you start a conversation with us about your business, we're going to be able to share with you not only what we do, but what other businesses have done to help utilize benefits as a way to propel their business forward. So we'll give you some neat ideas too on how to do it, and obviously answer any questions that you have. Before I jump though, hey John, do we have any? I think we have a few questions in there.
Yeah, we do. First one way back, let me go back to the top, was if someone needs to see a specialist like a dermatologist or other specialist doctors.
Yeah. So we have specialists. There's you don't need a referral. It operates like it's a PPO plan, so you don't need a referral. You actually I can show you even where you can go find those physicians within the First Health Network. It is available with Advantage Complete, but you have access to an incredibly, basically the specialists that are available in your area, and you can go see them without a referral.
So another one is, can employees participating in a qualified small employer health reimbursement arrangement, that's an acronym for you, can they purchase this insurance?
Yeah, so I think what you're talking about is a FICA program. Our FICA program is not out the door yet. We're working on it. Probably it'll be available. I'll say January 1. So what that means for everybody that doesn't know is that obviously your employers, you look at your statements, your number one line item for taxes is FICA for every single one of your employees. What you're able to do is you're able to divert those FICA taxes into this program. So basically your FICA taxes will pay for this so you can be able to provide free benefits to your employees. So it's just a little bit of paperwork. Obviously we have to go through the IRS on that one. It is in process, and that'll be available, but I'll just say it's going to be available Jan 1. Oops.
So somebody asked about what the dental benefit is. Is it an HMO plan for dental?
No, it's not. And so so every single thing that we use, every single carrier that we utilize is pretty much the biggest and the best carrier in the United States. So you can probably guess who our carrier is for the dental. Our dental program is with Aetna. They're the largest dental insurance provider in the country. So there are 263,000 dentists that are a part of this program. When we took a look and we assessed, and we always crunch numbers, when we assess dental, the way that dental insurance works, it's a little bit backwards. So if you have dental insurance, right, and you're familiar with it, you put $100 in, a month, and then $1,200 a year, but then they'll pay for up to $2,000 or $1,500 to $2,000. So basically, they're just using your money and paying for things and just hoping you don't go use it. I wasn't crazy about that. We weren't crazy about that concept just because it doesn't have that upper limit. Hey, what happens if I need, something that's more expensive? So when we worked with Aetna on this, they crafted a different program for us. And that program is they negotiate, because obviously there's massive buying power. So they negotiate these amazing rates with 263,000 dentists. And what we do is you just pay their rate. So now if you need a cleaning, you call up, there's a concierge, they'll book an appointment for you. It's cost you $35. If you need a crown, it'll cost you $100. You need a root canal, it's going to cost you like $300. Like, it's dramatic. It's what you would pay them basically, instead of paying that $100 on top of it. So that's how our dental program works. I will tell you that people buy Advantage Essential, that $29 a month program, every single month just for that. It's amazing. It's awesome. It's a really good program. But that's how ours works.
Okay, and I know, Olivia, we're crunched for time. I got about 6 more. I'm going to go rapid fire through these, Ken.
Yeah.
So real quick, do the hybrid plans meet the California state requirement for employee health insurance?
No, they don't. Yeah, only the only complete does.
The bigger one. Okay. Does zero commitment put the onus on the employee to pay for premiums if the employer offers the program?
Yeah, so if you do 100% voluntary, then the employee pays, and it can be payroll deducted, or they can pay direct. In regard, and by the way, and the other question probably wasn't asked, it is portable. So if people do leave, they can pay. They can, even if you're paying, they can start paying direct as well. So if you obviously, if you're paying for it, obviously you're paying for it, but you can make it 100% voluntary, meaning your employees pay 100% of it.
Okay, someone asked if long-term care is a requirement for businesses next year, if you happen to know that.
Ooh, I don't think it's gonna be a requirement for businesses. I don't know. You should look that up though. It's yeah, the I just know the legislation got passed. I know the way that in Washington it works. It's the onus is on, it's as an individual mandate.
So I'm gonna group two of these. Someone asked if Kaiser and Blue Shield are part of the plan.
No, so Kaiser is not. Blue Cross Blue Shield utilizes a similar network than ours. So ours is called First Health. And I'll show you that in just a second. And in fact, I'll show you that right now. Uses First Health. Our network's bigger. And so they're, yeah, wait, can you guys see my screen? The one that says, can you see this, John? Then the one that
No,
says
we
we are
can't.
the future. Okay, great. Sorry, I hit a button. So anyway, ours is bigger than the Blue Cross Blue Shield network. But Kaiser is not part of it. In fact, while we're on that, okay, so the link goes to this page. If you want to speak to a specialist about your benefits and get more questions, click here and you can set up an appointment. If you want to, and then on the other page,
Show us your screen.
what's that?
Can you show us your screen where folks can click?
Yeah, can you see my screen?
No. Oh, you can? Okay.
Oh, okay, I'll do it again. I just killed it and stuff. I hit some weird button.
There we go.
Okay, so on here, yeah, at the very top, you can see that you can schedule an appointment for your benefits. There's also a ton of information. I mean, we want people to make the right decision on their healthcare. So there's lots of information for you to dig into. Personally, I love this one. This is if it's a $0 deductible versus a $5,000 deductible. What does that mean? And that means if you had all these things happen in 1 year, you would have to pay for all of that out of pocket. If you had it with us, you would pay almost nothing. So it matters. What we've done is just we've analyzed how healthcare works, and we've created a program that's consistent with how healthcare works today. Other programs are built on this historic model that goes all the way back to the 40s. And so they're just they're not contemporary. And that's why they cost so much. The thing that I do want to show everybody, because the number one question we get though is my provider in network? I think that's a great question. I think everybody should just take a look at these programs. And so once you get to it, you'll come to this page, First Health Network. You can Google it. There's two of the large, there's two massive networks. This is one of them. They kind of go back and forth which one is the biggest each and every year. But this one, it's one of the two largest networks. What you're going to see is you can go in here. I'm going to click a physician. If I want to see a hospital, urgent care centers, what's around me, that's great. I put in a zip code that hopefully is somewhat close to you. And then you can just put a radius and you hit search now. What this will do is this will show you, and I'm going to show you this so you can find your own physician if that's something that's important to you, or if it's, I mean, obviously just knowing what physicians are available are important. But you're going to see, like I said, there's a million doctors. So if you're in this network, so you're always going to get these big results. If you travel between, there or someplace else in California, kind of check out what that network looks like. If you come up to Oregon, Washington, to Texas, kind of check out what that network is a little bit, kind of play around with it. Now you asked about specialists. So when you pull this up, you can actually take a look at, like in this one, here's an internal medicine, here's a, obviously family medicine, but there are actually some specialists in this. You can actually see when you go into these filters over here, you can see that, hey, you know what, there's 1,400, primary care physicians out of this 9,800, which means, there's some other ones in there. There are also, but then if you're interested in your physician, I'm just going to show this real quick. Physician name, you can type them right in here. If you're interested in the practice, you can type it in. Once you start typing it in there, it'll actually filter it down too. So you can find your doctor really, really fast. The other thing that I'm going to show you on this page, though, is I'm going to show you, and you can actually, if the provider search in here, this is where you can go to find if your dentist, see if your dentist is in there. 26,000, 263,000 dentists is probably in there. But also the other thing is I always encourage, if you're taking medication, is see if our medications are covered. Now, this isn't all the medications. When you open this, you can take a look at this. I mean, there's 3,000 medications. There's a lot. There's a lot of medications in here. So don't read through don't try to find your drug because they're not in alphabetical order. What you do is actually go ahead and use this search. So in which case you can already see I use albuterol. And so as soon as you start to search, it'll go find it. You can also use, like if you use a name brand, you can type in the name brand. More it'll find it as well. So good things for you good little resources for you to utilize if to make a good decision. The other thing that you can do is if you want to sign up your business, just make sure, okay, you're going here to sign up your business. You can book, I'm sorry, I just scrolling around. You can watch a little video about it. For most of it, from me today. If you want to schedule an onboarding, there was a link on the PowerPoint that's going to go out. It's also a link right here where you can talk to somebody. I always just feel like that's a really good decision, is just to do a review with somebody that's, we, just to give you an idea. I think we signed up 25 businesses already this week, which is positively unheard of in the insurance world. Like literally 80 to 90% of all the businesses that meet with us sign up because we really do make it a no-brainer. If you want to buy Advantage Wellness Complete or any of our benefits for yourself, you just go to any of these, enroll today. It's super easy. You go ahead, find the program that you want, you add it to your cart. If you want to add, I will just tell you, the technology wasn't perfect for this. If you want to add Advantage Complete, just make sure you're doing a family plan or individual plan. And when you hit add, you're going to have to put in your premium. We're going to double check it to make sure it's correct. This is down here before. This is that rate card that we showed you. Just go ahead and find your age. Is it single? Is it family? So like in my case, I would put in $444.26 in there, and I check out. After you check out, you're going to get another set of forms. So this is obviously just that enrollment and payment and all that good stuff. You're going to get another form that's going to ask for beneficiaries and a bunch of other stuff, more of that medical and stuff. There's only one knockout question, and that's that you can't be HIV positive or currently have AIDS. Other than that, we take everybody. It's guaranteed issue. So okay, just a couple things just to familiar as you start to explore. What I will just express though is that we speak with a benefit specialist, is that we love being transparent. Everybody that works for our company is incredibly passionate about what we're doing. And we love to share. We love to meet people. We love to, by the way, we build all of our programs based on feedback from our members. Our program that you buy today, if you signed up for Advantage Wellness Complete, and believe it or not, in 6 months is going to be even better.
Alrighty. So we do have a couple more questions that I'd like to for you to respond to before the end, so that way we know that everyone yeah. So is vision offered? And it's yes, correct?
Correct. Yeah. There's a vision program. Vision's kind of vision. It's free set of glasses, discounted contacts, free exam. It's not super exciting. You can get discounts on LASIK though. So if that's something that you're interested in, you can save a lot of money on LASIK.
Does the hybrid plan meet the requirements to not get the tax penalty for individual when filing for taxes?
No, it doesn't. It's not. Yeah. So the individual mandate, you're required to have a MEC program. and it may be an MVP program. So there's two programs, a MEC and an MVP program, and those require a little bit more than what's currently in the premier plan, unfortunately. And so the only one that's available that does meet the individual mandate is Advantage Wellness Complete, but that one does satisfy the individual mandate in California.
Alrighty, so that's what someone was asking, does this meet the California 1029 annual reporting?
Yes.
How many people do you service, and how many have signed up since the inception?
So we started selling benefits a year and a half ago. We have, just to put it in like the actual number, I don't know, but I'll put it in perspective for you. We've signed, just off the top of my head, 17 nationwide chains. Those chains have over 6,000 employees. And that doesn't include individuals and people outside the chain. So we service thousands and thousands of people. We are anticipating, just to give you an idea, we're anticipating about 20,000 people signing up just over the next 2 months.
Alrighty, do you offer HSA?
HSA, yeah, health savings plan. So pre-tax dollar health savings plan. Not right now. That's actually on the schedule for next year though. So awesome question. And you just found out some information about a product roadmap.
Okay, next question. What's the dollar amount of maximum coverage for vision glasses? Example, $400 max, 300, etc. And is it annual or something else every 2 years? Thank you.
Yeah, it is annual. I don't have the number schedule. Yeah, you can see I was born, but you can also get the white papers on what the maximum is for vision. I'm not 100% sure on that one.
Alrighty, and then I have a couple of questions. So this is California mandated, correct? Health insurance is California.
Yeah, health insurance is, you have an individual mandate that requires you to have a MEC qualified program, correct, in California.
All right. Do employers need to provide insurance? What if they don't? Is there a penalty for?
Yeah, okay, that's an awesome question. Okay, so there's an individual mandate in California. There is a nationwide mandate for every employer that has over 50 employees. So that's the mandate. So anybody who has less, so that the individual mandate doesn't apply to in California or anywhere. If you have 49 or less. Now here's the trick with it. It's 50 full-time equivalent. So what that means is you have to take your full-time staff, you have to add to that, you have to take all of your part-time staff, add up their hours, divide it by full-time hours, which is 30 hours a week. And that gives you the full-time, and then you add those two things together, get a full-time equivalent. The reason why I'm bringing this up is we've worked with hundreds of companies that have, like in home care, I think that's a good example, where they have like 5 full-time employees, but they have 150 part-time employees. They didn't realize they're actually a full-time equivalents is about 80. And so in which case there is a penalty, and there's 2 penalties. One, there's penalty A, which is 200, I'm kind of rounding here, $230 per month per employee that you're not offering insurance. And so obviously that if your full-time equivalent is 50, I mean, that's a $35,000 a year bill. If you have, then there's penalty B, and that's $456 per month for each employee who bought benefits off healthcare.gov. How we get you out of this program is if you just sign up for us, remember, $0. If you sign up for it and you just allow us to do an enrollment campaign, just all we're doing is informing your employees about our benefits and giving them an opportunity to purchase. Just by doing that, you didn't spend a dime, you got out of penalty A. Minimum 50 grand, I mean, $38,000 penalty that goes completely away. For every single person that signs up for the program, obviously you get out of penalty A and penalty B. Now, if you want to get out of both penalties, the best way to do it is just to contribute 50% of Advantage Wellness Complete to every, and all you have to do is offer to it. If they don't take it, if they want to go to Kaiser, or they go someplace else, they want to buy other benefits, you're offering Advantage Wellness Complete at half off will eliminate penalty B and penalty A.
Okay. What about cancer survivors? So is there a pre-existing condition?
No, we do not have, we do not have any pre-existing conditions other than HIV. Yeah, please. Yeah, come aboard if you're a cancer survivor. Love to have you. And by the way, congratulations.
Thank you. Enrollment period. I think someone had asked the question about enrollment period. So I could fill out the applications today and get insurance within the next week or so, maybe.
Yeah, so you have, right. Yeah,
Okay.
it's evergreen. You can go any month that you want. Your employees too, like, it's like you could roll this out and they don't all have to like jump in
Mhm.
right away. If they want to take 30, 60 days, 90 days to make a decision, something finances aren't working out right now, and perfect, great. We'll meet you where you need to be met. You do have to enroll before the 20th of every month to get it on the 1st. If you
Okay.
roll like between the 21st and the 31st, it just pushes off a
So
month.
people have 3 days to decide, right?
Yeah.
No pressure.
Should be an easy decision though, right?
It really is. And then, links to the PowerPoint. So you'll give me the PowerPoint and I'll send a thank you message to everyone
Yeah.
and put in the link in the PowerPoint. There's a couple of more questions. Does a married couple that want Advantage Wellness complete sign up for the family or individual plans? That's a good question.
So, okay, so we don't do a background check on, we don't require any marriage certificates or anything like that. Basically, when you sign up for a family plan, what the stipulation is that it's a couple that shares the same household. So it can be a partner, it can be a spouse, it can be, obviously married, it can be a life partner, whoever you decide, but you sign up for the family plan, correct?
Okay, you sign up for the family plan. I have another, great, excellent question. All right, so a lot of our businesses here at the LA Latino Chamber are under 10 employees, many
Awesome.
5, many just have 2. So how do those folks take advantage of this program?
Awesome. I love that. So you're going to go on to the site, yeah, I still recommend just doing a review, a benefit tour. By the way, we're doing so much business right now that when you sign up for a tour that you'll probably be with a couple other businesses, which is actually kind of cool because people ask different questions. And it's just how many people we're businesses that we're having right now. So you just set a tour. If you sold, if you're like, hey, this sounds great, all right, it's no risk, just hit it, fill out the link, um and that's it, and get going. We'll reach out to you after the fact and just find out how you want to build your plan, how you want to customize it yourself, and then we build your website, we pick a launch date, and then we go. If it's, if we can do a few ways for the enrollment, you can just give us your census. What we do is we do a totally digital campaign, so you get texts and emails and for 14 days. And then an opportunity to speak with a benefit specialist as well. We like to do a high touch, but we always like to, we don't want to be more intrusive in people's lives than we have to be. But it literally, it'll take you, the enrollment, giving us the information, making some decisions, doing the registration. Honestly, it's an hour of your time to get a full employee benefits, to be able to go to your employees and go, hey, we have an employee benefit program, and it's launching the beginning of next month. We do all of our enrollments from the 1st through the 15th of every single month. So just let us know what month you want to be a part of.
Okay. And then just we're gonna wrap it up. It's, let me see, 10:06. Last few questions. How many people are in a family?
Awesome. Okay. So with Advantage Wellness Complete, two, obviously, 2 adults and then up to 4 children. With the other programs, up to 8.
Okay. Do you work with brokers? I think that's something then John can maybe answer. Yeah.
Yeah, like, let's, again, our mission is to, make everybody a part of, give everybody access to affordable healthcare programs. So, I mean, if you're a broker, that's great. If you want to actually, we have other affiliate programs. If you feel like this is a complement to what you're doing, love to have you as aboard as well. Like, if you guys this is our logo, and we're building a community. We call our logo "People Helping People," and so I think just the more people. I mean, right now, finances are tough, and if we can go to families and we can say, "I'm going to save you $18,000 a year. I'm going to reduce your costs from $2,200 a month to $700 a month." That moves the needle. I mean, you are bringing so much relief to every single family, every single individual that's having to make really tough decisions right now. Yeah, the more people that we have that can help get that word out, the better that we're gonna do for everybody, for our entire community.
Alrighty, and then last question, maximum coverage for individuals and family, and are you registered in all states?
We are registered in all 50 states. And not only this is a nationwide program. So when you sign up, you can go anywhere with it. I'm sorry, what was the other part of that
The
program?
question, maximum coverage for family and individuals. Oh, someone had asked a really good question. Can elderly parents be covered under a family plan, particularly for long-term care?
Ooh, that's a good question.
Maybe you can answer that directly.
Yeah, I was gonna say wow. I do a lot of these presentations. Whenever I get a new question,
Mhm.
that's really interesting. I'm gonna find out about that one and then set up an appointment. I'm gonna email them today and I'll make sure that my team has that, or send me
Yeah.
an email directly and
Alrighty,
I'll
Don, can
fill
you
you in.
please connect and you and I can chat afterwards? And then
Absolutely.
that way you can connect. But I wanna thank John and Ken for that. And I just want to share that this was life-saving information, especially on your budgets. We know that many families really cannot afford, and it's between paying the rent, a new car, tuition,
Food's gone up
cost of
11%.
living,
Yeah.
rent, mortgage, I mean, you name it, everything has gone up, and this is a really good alternative to provide healthcare to our families, especially those who are cancer survivors. So I'm a big cheerleader for that. But I want to thank LifeExec because you guys are members of the LA Latino Chamber, so we're very appreciative. LifeExec is actually on our business directory, so you'll be able to find John's information there. On that note, we thank everyone for being with us this morning and have a great day.